Streaming. This is Chris. Are you in touch?
Welcome everyone to the World Health Organization's first ever Global Evidence to Policy Summit. My name is Elmer Huerta at the George Washington University in Washington, D.C., and I have the honor of being your moderator. Resilient, and sustainable global health. During the coming days, we aim to take stock and explore the lessons learned during the COVID-19 pandemic. We will also launch the Evidence-Informed Policy Network, EBIP-NET Call for Action, and a coalition that will take this call forward. This summit is a historic event as the pandemic has opened up strong momentum for evidence-informed policy making. During the coming 3 days, we are convening researchers and policymakers from all WHO regions and international institutions, member states, universities, research institutes, and partners. We will identify common challenges, share lessons learned, and provide recommendations supporting evidence-informed policymaking to spur progress towards the Sustainable Development Goals and the WHO's triple billion targets. This summit is organized by EBIP-NET at the 3 levels of the organization, with headquarters sessions, regional sessions, and a major focus on countries and research to policy case studies and lessons learned. While the summit today will be opened by the WHO Director General, the regional events will be opened by the WHO regional directors. The event is held in English with interpretations organized by the WHO regional office involved in the organization of this event in Arabic, French, Portuguese, Russian, and Spanish. Before giving you an insight into what awaits you during this first day of the summit, let's go through some housekeeping items. First, for interpretation into the said languages, please press the interpretation icon below and select the language of your choice. Second, you will see that the Zoom features for comments and questions and answers Q&A, which you can find at the bottom. Use the Q&A button to post questions to the panelist speakers and share your general comments on the chat. Third, in the comment section, we will be providing tweetable summaries of key messages, which you are welcome to use on social media. If you use Twitter, we invite you to use the hashtag E2P Summit 2021. Finally, should you encounter any technical problems, access the help desk on the virtual platform, the desk with the question mark sign. So, this first day of the summit has the theme, Beyond the Pandemic, Reshaping Evidence to Policy and Practice Mechanisms for Strengthened Country Resilience. We have an exciting program ahead with keynote speeches on innovating the evidence policy nexus for more equitable and sustainable global health, a ministerial panel on driving evidence-informed policy change and societal transformation, and a global expert panel on knowledge translation after COVID-19 with representatives from all WHO regions. During day 2, there will be regional and global focus events on lessons learned from COVID-19. Day 3 is about keeping the momentum and taking action. During that day, the EBIP Net Call for Action and the Coalition of Partners will be launched. Now, I am honored to give the floor to Dr. Tedros Adhanom Ghebreyesus, Director General of the WHO, for the official welcome to the summit. Dr. Ghebreyesus, please go ahead.
Thank you so much, Chair. Your Excellency, Chancellor Merkel, Commissioner Bachelet, former Secretary General Ban Ki-moon, Excellencies, distinguished guests, dear colleagues and friends. It's a pleasure to welcome you to this summit, which gets at the core of WHO's mission to use the best available evidence to improve and protect health. The caliber of speakers we have today highlights just how important an issue this is. Throughout her time as Chancellor, Dr. Merkel has built a powerful legacy for research and evidence-based policy in Germany. And Commissioner Bachelet has championed the human right to science, including the joint appeal for open science with WHO and others in the COVID-19 response. And former Secretary General Ban Ki-moon has been a strong advocate for evidence-based decision-making, including the establishment of the UN Science Advisory Board to provide the UN and member states with evidence-informed guidance. Thank you all for joining us today and for your support for the role of science in public policy. Science has always been at the heart of improvements in health, and it remains at the heart of everything WHO does. As part of the WHO transformation, we created a new science division in 2019 to improve the way we gather, analyze, and distill evidence into guidance for countries, and to support countries to translate evidence into better policies, better practices, and better and measurable health outcomes. Together with our regional offices, the Science Division also coordinates the work of the Evidence-Informed Policy Network, or EVIPNet, which was established 15 years ago to promote the systematic use of evidence in policy making, and is active in more than 50 countries. There are many examples of its success. In Brazil, the National Network of Evidence Centers has helped to bridge the country's vast distances to support the improvement of municipal primary care, the health of indigenous communities, and the COVID-19 response. In the Republic of Moldova, a local team supported by WHO developed an evidence brief on alcohol control to the Ministry of Health, which led to changes in legislation. In Uganda, health authorities with support from WHO pioneered an evidence-informed decision-making approach on drug-resistant malaria to update national treatment policy. The Science Division has also played a key role in the COVID-19 pandemic, supporting the Health Emergencies Program to produce and quality assure more than 1,600 guidance documents in the face of rapidly evolving evidence. In February 2020, just weeks after the first cases were reported, the Science Division and the Health Emergencies Program convened a global research and innovation forum, bringing together more than 500 scientists from 60 countries to identify key research priorities. That meeting laid the foundation for the development of tools that have helped to prevent, detect, and treat COVID-19. Through the Solidarity Trial, We also ran one of the largest and most diverse clinical trials to generate robust data on therapeutics. But the early months of the pandemic exposed uneven levels of research and advice in different countries. This demonstrated the need for countries to have robust systems to translate evidence into policy. And we have all seen how important it is to counter misinformation with high-quality evidence presented clearly to decision makers and the public. This summit is therefore an opportunity to take stock of lessons learned during COVID-19, and in particular, the need for country-led knowledge translation efforts. Let me leave you with 3 priorities. First, we cannot wait for another crisis to put scientific advisory mechanisms into place. The pandemic has underscored that the time to prepare and to earn the trust of the public is before a crisis occurs, not during. Second, we need cross-sectoral collaboration between the public and private sectors and civil society to turn science into action to save lives and protect public health. Third, we need to build sustainable evidence to policy translation mechanisms in all countries to put global evidence into local context and counter public distrust with evidence-informed, actionable policy recommendations. Thank you all for your participation in this important summit and for your commitment to harnessing the power of science to support WHO's mission to promote health, keep the world safe, and serve the vulnerable. I thank you. And Chair, back to you.
Thank you very much, Dr. Tedros. It is important what you say, that knowing that all public health interventions are local in nature, all public health practitioners need to respond to the charge expressed by you, how to transfer the concepts generated during this important global meeting to local public health units in large and small cities around the world. In other words, how to translate global evidence into local action. That is extremely important for all public health practitioners to remember. Our first session at this Global Evidence to Policy Summit is about innovating the global evidence policy nexus for more equitable and sustainable global health. I'm delighted to welcome our high-level keynote speakers. Her Excellency Chancellor Angela Merkel, outgoing Chancellor of the Federal Republic of Germany, Dr. Michel Bachelet, the current United Nations High Commissioner for Human Rights and former President and Minister of Health and Defense Minister of Chile, Dr. Ban Ki-moon, Chair of the Ban Ki-moon Foundation for a Better Future and co-chair of the Ban Ki-moon Center for Global Citizens and previously United Nations Secretary General, and Dr. Sumiya Swaminathan, the WHO Chief Scientist who brings 30 years of experience in clinical care and research. I now give the floor to Chancellor Merkel, who has a strong reputation of supporting the science policy interface and who has shown admirable leadership, especially during the COVID-19 pandemic. I have a message, Chancellor Merkel. She will be speaking in German. So please, you have the icon in your Zoom platform for the translation. You can activate it now so you can listen to Dr. Merkel as she goes by now. The floor is yours, Chancellor Merkel.
Ja, sehr geehrter Herr Generaldirektor.
Thank you, Director General, dear Tedros, dear Ms. Bachelet, dear Mr. Ban Ki-moon, dear Ms. Swaminathan, ladies and gentlemen. I would like to thank you, dear Tedros, for inviting me to speak at the WHO's Global Evidence to Policy Summit. When a disease develops into an epidemic and then into a pandemic, we have every reason to seek the advice and counsel of science. What kind of pathogen are we confronted with? What needs to be done at the local, national, global level in order to contain the infection spread? How can we make sure that we share the findings and evidence and the measures that have proven effective as quickly as possible? At the end of 2019 and the beginning of 2020, we knew but little about the SARS-CoV-2 virus. However, coronaviruses were not an unknown quantity. In Germany, research had been ongoing on this since 2006. And once again, we were reminded of how important it is that there is a network in the field of health research. I'm very grateful to all the expert teams at the global scale that have shared their knowledge with everyone in order to quickly decode the virus. As early as by mid-January 2020, we had the first PCR test providing us with diagnostics. And in less than a year's time, we were able to develop effective and safe vaccines. That was indeed a milestone in pandemic management. And as the German Chancellor, of course, I am pleased to note that German experts also had a hand in this. However important it may be that scientists establish networks, they also need to have a good rapport with politicians. In any event, we need to ensure that we provide sufficient national and international research support. Progress with regard to research, especially in an area that affects our health, should and must be that important to us. Unfortunately, though, not every country is able to provide for the necessary research capacities to the desirable extent. And it is this that illustrates the global importance of the Global Initiative Act Accelerator and its vaccine pillar, COVAX. On the one hand, we have been able to provide financial support for research into vaccines, therapeutics, and diagnostics. And on the other hand, we have provided poorer countries with vaccines. The G20 countries also committed themselves to further improving global access to urgently needed vaccines, therapeutics, and diagnostics. In so doing, we are moving closer to the goal recommended by WHO, and that is to make sure that a minimum of 40% of all people in all our countries are being vaccinated by the end of 2021 and 70% by the mid of 2022. In the medium and long term, we also have to continue to work to ensure that vaccines are not only produced in industrialized countries, but also in other countries, for example, in African countries. Undoubtedly, we will be facing new health challenges time and again. Thus, even a modern health system like the German health system has to be continuously developed further. For example, during the pandemic, we quickly noticed how important it is to further improve our reporting system, to start with the GPs, the laboratories and the health offices, all the way down to the Robert Koch Institute, our central institute for health monitoring and disease prevention. Undoubtedly, digitization plays an important part if we are to get a comprehensive picture of the infection's spread and activity. The interlinking of information and as clear and complex an overview are of elementary importance if we are to optimize our methods to treat and prevent the disease and the virus. But it's also important for political decision making, and that is why it's always been important for me to consult and ask the advice of experts from the fields of infectiology, immunology, the health system, and also from the field of ethics. For if we are to successfully fight the pandemic, we have to act as a society, and we need to provide the adequate political framework. If we are to shed more light on present and future infections and diseases, if we are to find the right answers, we need to develop and set up suitable platforms that allow for an exchange between scientists and politicians, between scientists and scientists too, not only at the national level, but also at the international level. I also believe that we need to be better equipped when it comes to find out more about where the diseases and epidemics have originated. And thus I welcome the fact that in setting up SARGO, the WHO Scientific Advisory Group for the Origins of Novel Pathogens, we're setting up a new unit of researchers that will be cooperating over a longer period of time. It will be their task to brief WHO about the emergence of new or novel pathogens. This will be of assistance, helping politicians to get at an earlier stage information regarding potentially alarming pathogens and thus be in a position to respond more quickly. Information and advice and counsel rely on data from areas like the environment, fauna, geography, sociology, and last but not least, from the health sector. The interdisciplinary and international collection, monitoring, and analysis of these data is no easy task. The more pleased am I that with the WHO Hub for Pandemic and Epidemic Intelligence, we are about to set up a new space in Berlin where data to help prevent other and further pandemics and epidemics will be analyzed, in which we can also develop the required instruments and test them. AI in particular can help us detect new connections in sets of data, thus allowing us to further research this area. The WHO Hub in Berlin will use these possibilities and these means and share any findings and insights with all the member states. In so doing, we will be able to earlier and better detect health threats and provide a basis for policy making. Allow me to summarize finally what in my eyes is of fundamental importance. 3 points. First, we need to make sure that there is more cooperation and more networking in the field of science, in the field of politics, but also between scientists and politicians. Second, we need efficient and effective structures. In order to achieve this, we need to place the financing of the World Health Organization on a reliable foundation. After all, WHO, as the coordinating body in the global health architecture, plays a central part. In addition, the mandates of all organizations and actors in global health should be clearly aligned. And third, we need to make sure that we further strengthen trust, because trust is an indispensable precondition of excellent cooperation. Pandemics know no borders. Shared challenges like pandemics can, despite national efforts being undertaken, only be overcome if we act together and cooperate. Instead of acting alone, we stand much better chances to successfully stand up to the horrors of pandemics. The present pandemic, with its catastrophic health consequences and also its impact on our economies, should serve as a lesson to us. We should build networks, structures, and trust. In so doing, creating the preconditions for our and future generations to better and more speedily respond to such health threats. We would also be well advised to lay down specific measures for better prevention, early detection, and response in a pandemic treaty or a similar legal instrument, and to lay it down in a binding manner. I think you have more than enough to discuss today, and thus I wish you a fruitful exchange of views during this summit. Last but not least, I would like to thank you all from the depth of my heart for your commitment and your contributions. Thank you.
Thank you very much, Chancellor Merkel, for your inspiring words. Now it is my pleasure to introduce the next speaker, Dr. Michel Bachelet. She was the first female president of Chile. During her 2 presidential tenures, she promoted the rights of all, but particularly those of the most vulnerable. Among her many achievements, education and tax reforms and the creation of the National Institute for Human Rights stand out. So do the establishment of the Ministry of Women and Gender Equality, the adoption of quotas to increase women's political participation, and the approval of Civil Union Act legislation granting rights to same-sex couples and thus advancing the LGBT rights. Dr. Bachelet, please, the floor is yours.
Thank you, Dr. Huerta. Excellencies, colleagues, and friends. It has been almost 2 years since governments and leaders had to swiftly make difficult choices to face multiple overlapping issues. And we continue to do so, as COVID-19 and its economic impact, coupled with the climate crisis, still pose enormous life-threatening challenges. But we have learned a lot during this month that can help us together recover better into a more equitable, sustainable, and resilient world. two prerequisites must be the basis of any decisions that have to be made. First is sound scientific evidence. That is what we have, what have let us know how the virus spreads, what could fight it, and how we could keep ourselves and each other safe. Analyzing a variety of data helped to track and fight the pandemic, and demographics helped countries understand who among their populations was most at risk. And you may be surprised that the use of sound science is also a human rights obligation. Which brings me to the second point. Human rights must be at the heart of the pandemic response. This is not to complicate matters, nor they are empty words. Human rights make efforts more effective. They are also useful guardrails at time of competing demands that keep us focused on a people-centered response. You may be asking yourself, but what good would human rights do in the middle of a multiple crisis? And in my experience as a medical doctor, former public health official, but also former president, I will answer a lot. Human rights provide the framework which can guide us when making the most difficult decisions. During COVID-19, we have seen countries that have put significant efforts to place scientists and experts in their task forces to deal with the pandemic from the medical, socio-cultural, and human rights perspective. These countries have shown more resilience. Others, who were swayed by political argument and misinformation, suffered more fatalities. Since the beginning of the pandemic, my office has developed a series of guidance documents that provides advice to government on how COVID-19 response can and should be human rights-based in areas such as healthcare, housing, emergency measures, among others. The guidance includes an emphasis on the collection and availability of anonymized, disaggregated data related to the pandemic. And the reason is simple. Disaggregated data will help COVID-19 response better address specific impacts related to gender, age, disability, or ethnicity, among others. It will also help remove barriers, preempt potential discrimination, monitor the rollout of health services, including vaccines, and ensure equal access to treatment. We also understand that there are challenges in maximizing public resources to meet human rights obligations. Aligning policies with the best scientific evidence available helps a state to do so during times of economic difficulties. With that in mind, my office launched the Search initiative in September 2019 with teams composed of macroeconomists and experts on sustainable development and human rights. Through our field presences, this initiative seeks to expand our support to countries on implementing economic, social, and cultural rights. It links human rights with economics to curb inequalities and contribute to the achievement of the 2030 Agenda and Sustainable Development Goals. And I'm happy to share a few examples with you. In Kenya, Moldova, Maldives, and West Africa, we supported countries in collecting and analyzing disaggregated quantitative and qualitative data to measure the fulfillment of retrogression in health and other economic and social rights. In Serbia, Paraguay, Peru, and Mexico, we work with stakeholders in assessing impacts of COVID-19 on different vulnerable segments of the population and in formulating recommendations that align economic and social policies with human rights. During technical discussions with international financial institutions, governments, and others in Lebanon, Zambia, and Ukraine, we assisted the development of recommendations on how governments can dedicate the maximum available resources to guarantee economic and social rights while recovering from debt and economic crisis. Dear colleagues, as I mentioned earlier, everybody has the right to share in scientific advancement and its benefits. The Universal Declaration of Human Rights makes it clear. The Committee on Economic, Social, and Cultural Rights, on its turn, has elaborated on the convergence of human rights and science in its General Comment 25. In other words, scientific evidence and the medical advances that can be derived from it must be universally accessible. But while access to misinformation is free and is easy and free, that is often not the case with scientific knowledge. The cost of this discrepancy to human rights and human lives are increasingly higher. Last year, my office made a joint appeal for open science together with CERN, with UNESCO, and WHO. We call on states, international bodies, science and medical institutions and practitioners to engage in different forms of cooperation to ensure the broadest possible sharing of scientific knowledge and the broadest possible access to the benefits of scientific knowledge. I commend the governments that supported this direction, whether in the form of effective and inclusive forms of communication or the distribution of health-related information, goods and services, including COVID-19 vaccines. Indeed, the pace at which we gained scientific knowledge in the past 18 months has been extraordinary. Through science, billions of COVID-19 vaccines have been produced at a rate which have helped save millions of lives. However, there are still huge gaps and barriers in the production and distribution to ensure that priority populations in all countries have access to them. COVID-19 has been the latest reminder that in our interconnected world, no one will be safe until everyone is safe. That my enjoyment of the right of health in Geneva is connected to the enjoyment of the right to health of others in every country. But amid the highly uneven and unjust vaccine rollout, developed and developing countries are on divergent paths towards recovery. That could usher a rise in inequalities that will further push millions into poverty and hunger, and which could ferment into widespread dissatisfaction and greater conflict. So we must do everything we can to avoid this. I emphasize once again that COVID-19 vaccine must be treated as a global public good. Private profit should not be prioritized over public health. To ensure improved access both to vaccine and essential medicine, I welcome initiatives that examine how to separate research and development costs from the price of the final product. This could be done through the WHO COVID-19 Technology Access Pool, which enables developers of therapeutics, diagnostics, vaccine, and other health products to share their intellectual property, their data, and their knowledge. Another way to facilitate manufacturers to scale up their production and supply of vaccine and therefore help to end vaccine inequity would be by waivers to the trade-related aspect of international intellectual property rights known as TRIPS. In that regard, I'm glad to hear that the recent talks among member states at the World Trade Organization have advanced towards convergence on how to address TRIPS in COVID-19 response. I hope that these talks further progress during the upcoming WTO's 12th Ministerial Conference into a temporary TRIPS waiver or an agreement that applies intellectual property rights in a manner that upholds and strengthens human rights. That includes the right to food, to health, and science for all people, especially those left furthest behind. Dear friends, during the recent Human Rights Council panel on COVID and inequalities, I was heartened to hear concerted calls for concrete action that prioritizes people's right to health and right to life. As I have said before, we must learn the lesson taught by COVID-19. This is the only way to recover better. With human rights and scientific evidence, we can still win back the development gains that we have been recently lost. We can reverse the pandemic of inequalities that COVID-19 has exacerbated, and we can rise out of this crisis with an equitable, sustainable, and resilient world. I thank you for your attention.
Thank you very much, Dr. Michel Bachelet. Now let's gonna hear from Dr. Ban Ki-moon. He served as the 8th Secretary General of the United Nations from 2007 to 2016. He led the efforts for the landmark Paris Climate Agreement, and under his leadership, the Sustainable Development Goals and the 2030 Agenda were created. Mr. Ban Ki-moon currently serves as the co-chair of the Ban Ki-moon Center for Global Citizens, which seeks to empower youth and women to become active global citizens in creating a sustainable future for all. He is on video. Go ahead.
Honorable Tedros Adhanom Ghebreyesus, Director General of WHO, Her Excellency Angela Merkel, Chancellor of the Federal Republic of Germany, Honorable Michel Bachelet, UN High Commissioner for Human Rights, Excellencies, distinguished speakers, and ladies and gentlemen. Thank you all for the opportunity to speak and share my perspectives at this timely and vital WHO Global Evidence to Policy Summit. The pandemic has made clear that we are living in an interconnected world and that no country, regardless of its size, wealth, or technological sophistication, can tackle COVID-19 alone. Cooperation and solidarity, partnership, and global governance are needed in our fight against COVID-19. Failure to respond effectively in the initial stage in many countries amplified psychological panic and confusion and unnecessarily politicized the local and global response. This situation exacerbated social instability and resulted in the collapse of global partnership and systematic management of the pandemic. We need to take stock of lessons learned to ensure the next potential pandemic and crisis can be addressed effectively based on evidence-informed policymaking. Learning from the successes and failures of each other is fundamental to improving our future response to pandemic. Listening to scientists and experts and sharing experience and expertise can make effective policies and best practices to be disseminated globally. Assessment of experiences and responses to COVID-19 of countries with better performance can provide lessons and implications for other countries that are still struggling with the health, social, and economic crisis triggered by COVID-19. Working together requires fast and non-discriminatory sharing of knowledge and the readiness to learn from each other. This summit is a prime example of how the world should get together virtually to exchange valuable lessons and provide the basis for sharing evidence-based policymaking. The Republic of Korea has maintained a high level of transparency and openness in managing the pandemic and presented a unique example of applying advanced science and ICT in maximizing the efficiency of coping with the crisis. But in fact, such a decisive and prompt response was possible only because Korea experienced earlier pandemics such as SARS, bird flu, and MERS, even before it was struck by the COVID-19 pandemic. The main secret of the Korean model is that it did not waste the valuable lessons it has learned from the previous pandemics and applied evidence-informed policymaking in its response to COVID-19. I'm sure the Korean case can offer many lessons for evidence to policymaking practices.
Dr.
This is why Ban Ki-moon Foundation for a Better Future has worked together with the Asian Development Bank, ADB, and initiated the establishment of the PKM Sustainable Health Management Platform, a new global information and technology-based response platform. This platform allows trusted scientific information and policy options related to COVID-19 to be easily accessed by all countries and thereby help foster evidence-based decision-making. The establishment of a new global information and technology-based response platform allows vetted scientific information and sustainable policy options for dealing with COVID-19 to be rapidly accessible to all countries. For the evidence-informed policy decision-making, which is the core goal of the Global Evidence to Policy Summit, This platform accelerates the aggregation of professional information on COVID-19 and facilitates the dissemination of lessons learned from country experiences. The Platform for Sustainable Health Management Solutions will provide a robust response mechanism that offers professional, non-political, neutral, and practical solutions for health emergencies. Our hope is that the platform can elevate global partnership to address COVID-19 through its information sharing capacity and help strengthen health systems and global capacity to address COVID-19. The COVID-19 pandemic should also be a wake-up call for better collaboration to achieve the Sustainable Development Goals, SDGs, in short. The SDG vision for the future is to ensure that nobody is left behind. The SDGs offer a roadmap to build back better and greener after the pandemic. Less inequalities, construct healthy societies, and enhance global resilience to climate and new pandemics. To meet the SDGs, global collaboration and the global aspiration for international and regional cooperation, innovation, and engagement by all stakeholders are essential. There is no country that is resourceful or powerful enough to achieve the SDGs single-handed. The pandemic has made clear that we are living in an interconnected world, and countries need to put their hands together to work in global solidarity. While the COVID-19 pandemic has caused untold devastation around the world, it also provides us with a generational opportunity to build back better. We must strengthen our health systems and reduce inequalities to be prepared for future pandemics and build a better future for all. Every country must recognize that the only way to achieve these objectives is through effective knowledge sharing, multilateralism, and regional cooperation. The international community must elevate its collective efforts to address this crisis and develop its information sharing capacities. Information and knowledge sharing are public goods. Ultimately, the lessons learned from the pandemic must reinvigorate the necessity of cooperation and solidarity based on multilateralism and guide us to a more inclusive, sustainable, and resilient future. I wish you all a successful and insightful summit. Thank you all for your attention and leadership.
Thank you very much, Mr. Ban Ki-moon. Now we are going to hear from Dr. Sumiya Swaminathan. She was appointed WHO's first chief scientist in March of 2019. She is a pediatrician from India and a globally recognized researcher on tuberculosis and HIV. She brings her 30 years of experience in clinical care and research, and she has worked throughout her career to translate research into impactful programs. Dr. Swaminathan was Secretary of the Government of India for Health Research and Director General of the Indian Council of Medical Research from 2015 to 2017. In that position, she focused on bringing science and evidence into health policy making. Dr. Swaminathan, the floor is yours.
Thank you very much, Elmer, Your Excellencies, Dr. Angela Merkel, Chancellor of the Federal Republic of Germany, Dr. Michel Bachelet, UN High Commissioner for Human Rights, Mr. Ban Ki-moon, former Secretary General, and Dr. Tedros. First of all, I want to thank all of you for your generosity of your time and also for sharing your very valuable thoughts about this whole area and space of how to really bring data and evidence into policy making, something that the COVID pandemic has really highlighted and brought to the fore. But obviously, the implications of this are far beyond the pandemic. We've always needed data to guide our policy making and evidence-informed decision making. But I think the pandemic has just highlighted the absolute need, but also highlighted what the challenges are, the gaps are in every country. I think that there's been an opportunity to examine how decisions were made, where there were challenges and gaps. And of course, we have been challenged. Everybody has been challenged, criticized, but hopefully this provides an opportunity to do better in the future. On our side here at the WHO, as you know, the science division is fairly new. It was set up about 9 months before the pandemic hit us. And so right from the beginning, we started working very closely with our emergencies program led by Dr. Mike Ryan to really set up new processes and mechanisms for rapid data and evidence review so that the guidelines and the recommendations that were put out by WHO were based on the most recent available data from all parts of the world, were appropriately reviewed and synthesized, because not all information out there is the same. There are differences in quality that need to be taken into account. There are differences in study design and so on. So you need experts, you need methodologists who are able to synthesize that evidence and make it in a format that can be understood. We had to also set up expert advisory groups that are free of conflicts of interest, because again, when major decisions are being made, particularly on which drugs should be used for treatment or which vaccines meet the benchmarks and the standards, it's important that the groups that are making those recommendations are free of conflicts of interest. We also very quickly recognized that there were gaps in the research enterprise or ecosystem, that there were a lot of duplications, a lot of very small studies, clinical trials that were being done in many countries, but they were not providing the kind of evidence that you need. So clinical trials need to be of the right size, they need to ask the right question, they need to enroll the right number of participants, and then you need to analyze them properly. And this is why WHO set up through its R&D blueprint mechanism. This was something that came about after the Ebola outbreak of 2016, when there was a gap, clear need on the ground for research, and there wasn't a good mechanism to do research during emergencies. And so the R&D blueprint for epidemics was set up at that time within the emergencies program, but supported by other parts of WHO. And it has been very successful in developing research roadmaps, in laying out the knowledge gaps, in bringing people together, not just for Ebola, and then later on for other diseases like Nipah and Lassa fever and the set of priority pathogens. But they also had in there a pathogen called pathogen X, for which a roadmap was already available. So it was relatively easy to get into that, to convene experts, and to then start the process of actually undertaking the research, providing protocols, standard protocols that countries could use, and so on. We also decided, or we had to put out evidence guidance even before the evidence is complete. And sometimes you need to update your guidance as you learn new things, because this is a new pathogen, a new organism, a new disease. And so we set up what's called the living guidelines approach, where there's constant updating of specific recommendations based on new evidence. The best example of this is the living guidelines for COVID therapeutics, where we started with drugs like hydroxychloroquine and very quickly were able to show that it had no impact, but then went on to looking at specific antivirals like remdesivir, the monoclonal antibodies, corticosteroids, and now most recently, we are now looking at the small molecules from Merck and Pfizer, the new antiviral pills, which could actually be very, very important in the future for managing people who get infected to prevent them from developing severe disease. So many systems in WHO were actually adapted and modified to meet the needs of an emergency and a pandemic, but they also brought out, for me, very importantly, the immense possibilities of doing things differently in the future. A disease like tuberculosis, which still kills 1.5 million people every year, there's no reason why we should not use these global convenings, the collaboration that we saw between scientists, governments, funders, private and public sector to develop new treatments, new vaccines for drugs, for diseases like TB, but make them available. And I think Dr. Bachelet really put a lot of focus and highlighted the fact that during a pandemic, or even for other public health emergencies like tuberculosis, it is really important to think about saving lives before we start thinking about profits. And it's important that data and research that is generated using public funds, using taxpayer funds, should then be made available to the public at large as a global public good. And so I think that philosophy that really needs to be taken on board by everyone, by countries everywhere. So while there are lessons that have been learned, we have an existing mechanism, which is the EBIPNet Secretariat, that's actually organized this, and I'm very, very heartened to see so many people connected to this. Clearly, there is a lot of interest in this topic, and the EBIPNet Secretariat in WHO has been very active for over a decade, trying to build institutional capacity within countries. And we know today that this is essential, that it has to be multidisciplinary. You need the social and behavioral sciences as much as you need the quantitative sciences. You need the ethicists, the bioethicists. You need the legal expertise. You sometimes need philosophers and jurists, and also the lay public, people who represent communities, civil society. Their voices are very, very important and are often overlooked when decision-making is being done. So rather than a top-down approach, it would be great to see a new way of decision-making at the country level, which really involves all stakeholders, discusses solutions, not just the problem, but the solutions, and finds a solution that probably is locally relevant, is contextual, is embraced by the community. And we've seen, again, if communities do not embrace the decisions, if they question the decisions of authorities, then it's very difficult, whether it's vaccine mandates or other kinds of public health measures that have been imposed. The communities really need to be engaged. So there is a lot of opportunity. This is a 3-day conference that's going to have many sessions, but the most critical element is really the regional days that will be held tomorrow. Every WHO region is going to convene discussions around some of these topics, and then we come back on the 3rd day to again convene at the global level to understand what lessons have been learned, and really how can we take this forward and implement them. So with that, I'm going to hand it back to the moderator with, again, many, many thanks to our very distinguished dignitaries who joined us this afternoon. And thank you to Dr. Bachelet, particularly, for staying on for this whole session. We really value your voice as a strong supporter of not only human rights, but also health as a human right. Thank you very much.
Thank you very much, Dr. Sumiya. Very inspiring words. I think these 4 speeches today remind me my first day of class at the School of Public Health, when the teacher told us, if you have a problem in your community that you want to resolve, you need, on one hand, a good communicator, somebody who can inform the public and gain their trust. And in the other hand, you need a politician who can make the right changes. This is what it's all about this session, bringing the gap between science and policies. I just want to show you something to the audience. It's something that we call the journalism. It's art form by which a person, Alex, he is drawing the ideas of our panelists. If you can share his screen with us so you can have a look. Every speech has its own drawing, and you can visit them at the art gallery, where Alex Hughes from Drawnalyst will display his live drawings from selected summit sessions during day 1, 2, and 3. And now we go to the next part of our session, which is a panel discussion with ministers of health on leveraging evidence for policy change and societal transformation.